Welcome everybody, good morning, thank you for attending, and hopefully our presentation will excite you all and you'll find it interesting. We'll have a question and answer session at the end, so please do think of some questions for us. So I'll introduce you to our company. SC21 is an abbreviation of Stem Cells 21, which is our first brand that we launched. I founded the company back in 2007. And we've been clinically using stem cells now for over 12 years, and we've treated a wide range of conditions and well over 2,000 patients. We also supply stem cells to third-party institutes around Thailand and Southeast Asia, and collectively the number probably well exceeds 4,000 clients who've received our stem cells over the years. Okay, so I'm one of the founders, and my business partner, Mr. Sergey Dmitriev, he's the other founder, who's unfortunately not here today because of the COVID restrictions on entering Thailand. But as I mentioned, we launched the company in Bangkok 13 years ago, 12 years ago in clinical practice, and it's been a wonderful success both for us and the patients, and we've treated, like I mentioned, a range of conditions which are showing fantastic improvements, complementing mainstream medicine or as an alternative treatment source. So within our group, we've established a number of sub-brands. IntelliHealth, which is our clinic brand, Stem Cells 21, Immune Cells 21, and Ipsc 21, which is our cell culture laboratories and specific treatment-focused brands, and SC21 Biotech, which is a consumer product brand that we've established. So speaking with me today is Dr. Nicholas, who will introduce himself.
Sure, nice to meet you all. I'm just going to tell you my background quickly. I studied bioengineering in London, and then I did a PhD in neuroscience, and then I went to work in Japan under Shinya Yamanaka, who's maybe the most famous stem cell scientist in the world, and started collaborating with Paul over the last few years, and then we finally teamed up this year.
Okay. So a little bit of an introduction to our group first. We have a couple of short videos about each brand and some information which I will explain. So firstly we have IntelliHealth, which is my clinic brand. So I'll show you a little video here. Oh, 1 second, bear with me. Let me just see on the audio for the videos. Okay, I do apologize for that. We will start again. Okay, IntelliHealth, which is our clinic brand. Okay, so as you will see, this is our medical center in Bangkok. We actually have 2 clinics in central Bangkok. We provide treatment in a luxury setting. We focus on modern approaches such as biophoton therapies, different intravenous infusions like curcumin and resveratrol, and certain molecules that are showing incredible results in a lot of conditions, as well as mainstream medicine like standard dermatology, health checkups, etc. Okay. So as I mentioned here, we focus on anti-aging, health checkups, specialty testing. We have our in-house laboratory that do some very unique diagnostic works. We have our different specialists within our clinics. We have orthopedic doctors, as well as dermatologists, as well as neurologists and ophthalmologists, and our full-time medical team that treat all of our patients. So now we have Stem Cells 21, which is our core brand for stem cell therapy. It was the first brand we launched that specializes on human mesenchymal stem cells in a therapeutic setting. So I'll just show you a little introduction video for this brand. Okay, there we go. So, Stem Cells 21, it's our laboratory focused on human mesenchymal stem cells. So we culture cells there, we assess their function there, we cryo-store them in our cryo-storage facility, and also we prepare them for therapeutic use within our clinics. So over the years, we've optimized their harvesting, characterization, and cryo-storage and revival for therapy. We've been utilizing mesenchymal stem cells, like I said, for 12 years. And over the years, we've really developed our scientific arm, and we really produce a very high-level stem cell. Okay. So, our signature is umbilical cord-derived mesenchymal stem cells. This is a young source of material, and the cells extracted from this tissue are very vibrant and hold higher rates of regeneration and immune modulation than aged adult tissue. And we'll explain some of the reasonings for this later in the presentation. So we utilize umbilical cord mesenchymal stem cells for anti-aging and age-related disease, degenerative diseases, immune disorders, and issues and traumas, as well as anti-aging and rejuvenation of the tissues and body. Okay, now we have Immune Cells 21, which is our brand for immune therapies, and I'll just play you a very short introduction video on this brand. Apologize, this replication of the previous video. I'll just verbally explain Immune Cells 21. So Immune Cells 21, we culture natural killer cells from autologous blood. These are used for the treatment of cancer, cancer prevention, immune disorders, and now most recently as anti-aging therapies. As our cells become senescent in the body and can no longer function, our immune cells should engulf these cells and remove them to allow healthy organ turnover. So we now know that immunotherapies are very important in anti-aging as well and maintaining healthy organ turnover due to the removal of senescent cells. These cells come from autologous blood. So the patient's blood is extracted and we culture these immunotherapy cells, the natural killer cells, for these therapeutic approaches. Like I just mentioned, they are utilized for cancer prevention, cancer treatment, low immunity disorders, and infectious disease. And here you can see some image of natural killer cells under a microscope. Okay, and the last brand that we'll feature today will be Ipsc21, which is our brand which Dr. Nick specializes in, which is induced pluripotent stem cells. Okay, so Ipsc21, like I mentioned, is specializing in induced pluripotent stem cells. These are a very unique class of stem cell, which we'll explain to you a little later in the presentation. We utilize a method of creation of the iPS cells with something called microRNA, which Dr. Nick had learned in his time in Saira Institute in Japan, and he will introduce this to you a little later in more detail. It's a very exciting part of our company. And these cells can be utilized in a different aspect. These cells are used almost as your factory source to create your own therapeutic cells in the future. So they're a source of biologically young cells. We utilize them in disease modeling, drug testing, and therapy response testing, and as a gene-corrected cell bank. Some of the terminology may be obscure for you, but Nick will explain it a little later. This is just a little summary. Okay, so now we'll get into the nitty-gritty of the presentation. What are stem cells? We have a 4-minute video for you, which will explain to you the principle of what a stem cell is, and then I and Nick will explain to you with our presentation some of the core fundamentals.
In the early embryo, very soon after fertilization, there are stem cells that are able to differentiate or mature into any other tissue in our body. These cells are therefore called pluripotent stem cells. But very quickly thereafter, they become specialized. They can only contribute to the tissue in which they live. These are tissue-specific stem cells. So stem cells in the brain only produce new brain cells, and those in the gut produce gut cells. Almost all our organs contain a small population of these tissue-specific stem cells. In every tissue, many cells die when they reach their normal lifespan or after injury. In some tissues, the lifespan of cells is very long. Cells in the heart, skeletal muscle, brain, and the lens in your eye all live very long. In contrast, in other tissues, the lifespan of cells is very short, such as skin, gut, and blood. In fact, every week, the inner lining of your gut is renewed, and every month your skin is replaced completely. This is possible by tissue-specific stem cells, which continuously replace cells that have become lost. One could argue that tissue stem cells are nature's own anti-aging agents. Without these stem cells, many tissues would age prematurely, as no repair could ever happen. However, whereas skin wounds recover very quickly in young infants, as we grow older, healing gets more difficult. Many old people suffer from too few blood cells and become susceptible to infections or anemic. It seems very plausible that at least some aspects of reduced tissue functioning during aging result from a reduced functioning of stem cells. How can stem cells age? as stem cells divide very often during the lifetime of the organism, they need to replicate their DNA and pass this on to their two daughter cells. Damaged DNA is therefore bad for stem cells. Patients that suffer from diseases that result in increased levels of DNA damage typically have problems with regenerating tissues and age prematurely. A special case of DNA damage relates to the ends of chromosomes, also referred to as telomeres. These ends shorten a little bit with every cell division. If the ends become too short, a stem cell cannot properly divide any longer. There may be multiple other reasons why stem cells perform worse with age. One of these appears to relate to the process of epigenetics. Epigenetics refers to the program that dictates which specific components of the DNA are used by a cell. For example, the hemoglobin gene is present in all cells of our body, but it is only used by red blood cells. Similarly, the insulin gene is only used by cells in the pancreas. DNA in a cell is typically very compact, and compact DNA cannot be used. If a cell needs to use a stretch of DNA, for example, to produce hemoglobin or insulin, this part of DNA needs to open up so that it becomes accessible. Epigenetic enzymes take care of this and locally open up or close stretches of DNA. Epigenetic regulation can be compared with the instructions that a software program uses to select which components it needs at a specific time point to execute a certain function. It has become clear that these epigenetic instructions are very important for stem cells, and for unclear reasons change with age. This may result in some information becoming inaccessible in aged cells. At present, we do not know. But if we would be able to find ways to keep stem cells functioning properly during aging, tissues would remain more healthy.
Okay, there we go. That was an introduction into what stem cells are. I hope you have some idea of stem cells and why they age. So Nick will now introduce some of the aspects of stem cells for you.
So I want to try to go through some basics about stem cells because I think, we've all heard about stem cells, we all have maybe some idea, but I want to start with some very basics and then start to talk about some specialist types of stem cells. First thing to say is there are many types of stem cells. We all have many stem cells in our body right now. So let's talk about the key fundamental property. So the fundamental property of every stem cell is that they have these two characteristics. One, that they can self-renew, they can replenish themselves, so they are self-renewing. And two, that they can differentiate or specialize into at least one other type of cell. Can we have the next slide? Thank you. So with those core properties, there is a hierarchy of different stem cells with what's called different potency. So for example, as they mentioned in that video, in the developing embryo, you have these pluripotent stem cells which will ultimately go on to make every tissue in your body. They can produce every type of cell in your body. So obviously that's been a very, very interesting kind of the holy grail of stem cell research for a long time. However, in our tissues right now, we have multipotent stem cells like blood stem cells, which are producing, dozens or a few different types of cells to replenish systems. So this could be neural stem cells, which produce every type of stem cell of the brain. It could be bulge stem cells in your skin, which produce every type of skin cell. And this is continuously happening. Crypt cells in your gut producing new gut cells. Finally, at the bottom, there are progenitor cells. So progenitor cells are stem cells which have the least potency, so they typically only produce one other type of cell.
Okay, just point out, in our therapies, we utilize multipotent stem cells derived from adult or fetal tissue, i.e. autologous from your aged adult bodies or umbilical cord tissue. Okay.
So, as they mentioned in the video as well, when you're born, you have extremely potent, extremely healthy cells, stem cells. Like overall, your cells age. Okay, that is the fundamental underlying mechanism of aging. Cells themselves accrue damage. Their systems become less functioning. So during stem cell division, during the self-renewal process, the problem is that a lot of these multipotent stem cells, like for example your blood stem cells, they become damaged, they accrue problems, and it means that they have less ability to produce new cells. Sometimes they have a bias towards one cell over another. Also, they deplete in number, so it means there is less stem cells to produce cells at all. So typically, for example, in immune aging, you lose certain immune cell populations, immune cell number, as you lose the immune stem cells.
Yeah, so to summarize, multipotent stem cells, they have limited self-renewal ability. Each time a cell replicates itself, it loses some of the telomere strands. When the telomeres are no longer existing, they become senescent in function, and they can no longer divide, and they can no longer function. So with each replication, they lose stemness. It's like how our body is aging. With each year, after adolescence, we lose functional aspects. We become more sluggish, we're less vibrant, we're less energized, we have less response to infections, more chance of disease progression.
And the general kind of working idea is that after around 25 or 30, the rate of production of new cells gets outpaced by the loss of cells. So that's why we struggle to recover from injuries, from things like this.
So throughout our time, we are reducing in cell numbers. Obviously from a newborn, we have a lot of vibrant, high-functioning cells. Through adolescence and teen life, they're pretty stable. But very rapidly after the 20s on to later life, there's a massive decline, both in the number and the function. So cells begin to mutate and become senescent, and if you don't have a good immune system, you don't remove the senescent cells, and they hang in the body mutated and can lead to problematic tissue development. But if you have an optimized immune function, these should be cleared. But they do decline in numbers, and they do mutate, and they do reduce in function as we age.
Yeah. Let's see the next slide. So I mean, you know, when you are born, you have a very, very high ratio of stem cells to your other cells. So your tissues are rich in stem cells. And we all remember and see how quickly children recover from injuries, scratches, etc. But these numbers deplete exponentially over life.
So sure, and we see a much higher risk of disease progression with the less number of cells. We have less of an army to respond to the call. We have elderly soldiers instead of young soldiers. So it's quite obvious that our ability to protect our bodies is declining with age. And this is because of cellular aging.
Yeah.
So
that brings us to the first kind of special class of stem cells I want to talk about. So what we just talked about was general stem cell information, this idea that stem cells are kind of the source of cells which are constantly needed to keep our tissues functioning, right? However, there are some special classes, and we're going to focus on two today, the most important for this presentation being mesenchymal stem cells. Now, these stem cells are fundamentally stem cells. I think you go to the next slide. They have the two fundamental stem cell properties. They can self-renew themselves, and they can differentiate into other types of cells. So they live in our bone marrow, in fat tissue, in our tooth roots, in different places around the body. And they look every day like a normal stem cell, just replacing themselves, and they can become other types of cells. However, they have very, very special functions. They are a kind of totally unique cell. The way they work is absolutely fascinating. So one of the top experts in the world, David Correa in Miami, he describes them as the kind of first responders. Okay, so what happens is, in your body, when you have an injury, trauma, some disease, some degeneration, some problem, in your body, everything works by cell-cell signaling. Okay, so if a cell has a problem, it releases molecules which will go somewhere else and tell another cell to panic or do something. So for example, if you have some trauma or injury or disease, the inflammation signaling molecules or whatever it is, these signals will reach these mesenchymal stem cells in the bone marrow. And what they do is they become activated, they migrate out of the bone marrow or wherever they are at that time, and they home to the site of the trauma. And when they arrive there, they work as the kind of coordinating responder to signal to all of the other local cells to coordinate the regeneration. Specifically, that is, firstly, reduce harmful immune response. So let's imagine you have a cut, The first thing is immune cells are flooding the region, trying to stop pathogens or bacteria from proliferating. First, the mesenchymal stem cells will suppress the very harsh immune activity. That opens the window for regeneration. Next, they signal to local stem cells, so these other progenitor cells or other less potent stem cells, to start to produce new tissue. So they activate, for example, in skin, the skin stem cells to produce new skin cells. At the same time, they activate reformation of blood vessels, etc. So in our body, just naturally, not talking about therapy, they have this fascinating role, which has only really become clear in the last 5 years. I mean, 30 years of quite a lot of good research, but the last 5 years we've really come to understand that this is all happening as a kind of coordinator, signaling to the local environment to do this. This is a list of some very interesting therapeutic actions of the cells, and I could go on forever. There are many more, and teams are discovering new ones every week. But let's talk about some of these functions that they have. So firstly, basic things like I mentioned at the top, they have this homing ability, so they will go where there are problems. Secondly, they can, in that location, engraft, attach, and turn into other types of cells, so especially in your own body, they will go to where they're needed and can replenish the cells themselves in that situation. Also, they have these advanced cell signaling systems, and part of this is that they are responsive. They have context-dependent responses. So if they arrive somewhere, they can detect the signaling environment of where they are and coordinate the appropriate response to what's needed.
Certainly, they're very intelligent cells.
That's the thing. That's what I want to get across. They have a lot of complicated systems. They can coordinate repopulation. So, for example, you've had some trauma, some loss of tissue, they can activate the migration of new stem cells into that region to repopulate the stem cells that are needed to be there, and then they can produce new tissue themselves. They can stimulate angiogenesis. They are potent stimulators of new formation of new blood vessels. So that's why in America they were the first approved treatment for diabetic ulcers to help with ischemic wound healing. Immunomodulation, so they generally modulate the immune activity. I mean, it's almost like a silver bullet where you could say they just stop all harmful immune activity in a context-dependent way. And then they have anti-apoptotic effects, so they stop cells from dying. So for example, if you have a trauma or if you have degenerated tissue, you have cells which are on the brink, they have lots of damage, they're close to dying. MSCs, these mesenchymal stem cells, they stop them from dying, and then they activate repair systems, regeneration systems. I mean, like I said, there are many, many more. For example, neural plasticity, they improve gut health, they improve local microenvironments. You could go on forever. And, I don't want you to worry too much about this slide, but what I want to tell you about this is that, as I mentioned, these incredibly powerful therapeutic effects, which are, have been well understood in their effect for a long time, the really big advancement recently is we understood how this is working. And it's working through this complicated array of signaling molecules that MSCs produce. And these include things which are maybe easier to understand or you might have come across before, like growth factors, basically molecules that will tell a cell to do something. Or they could be genetic material, or even one of the kind of most interesting and one of the newest areas of research, and where we know the least, which is these packages, which are called extracellular vesicles. So they actually produce little kind of care packages which can carry cargo. So they can put in there mitochondria to make energy, resources, and in a situation where there is chronic ischemic wound, they will start immediately producing resources for all of the cells around them.
So basically, this is one of the most powerful tools of an MSC. All day long, they are pumping out proteins, and the different proteins being displayed on the screen. But the issue with aging, and as the cells age, this production of secretome or protein reduces, and it can change. So young stem cells produce a very powerful anti-inflammatory profile, very strong immune modulation, but as the MSC age through multiple replications, they can almost turn pro-inflammatory. So elderly people have more chronic inflammation. A lot of it is to do with this aging of MSC. They don't have the ability to suppress chronic inflammation anymore, and in some respects, they actually can increase it. So the young, vibrant MSC produce such an abundance of these molecules, and they are probably the most powerful tool in regenerative medicine. Of course, stem cells can differentiate into tissue, but this migration to problematic areas and the profile proteins they release to address the environment in an intelligent manner is certainly the most powerful tool. And right now in our laboratories, we're investigating certain ways to enhance the output of certain molecules and collect and isolate the molecules only to eventually lead into a cell-free therapy in the future, or move regenerative medicine out of the clinical setting and allow some home use aspects by utilizing molecules and not the actual cell. So it's a very exciting area.
So basically then a little bit about how we work on and produce these cells. I mean, we first work with their kind of unique fingerprints. So all cells, well, if you're lucky, most cell types have a kind of unique fingerprint of receptors on their surface, something you can use to identify them. So MSCs have their own ones. So firstly, we have this umbilical cord tissue. We're able to expand out and isolate and purify extremely high purity of these extremely biologically young MSC.
So basically, MSC have a unique fingerprint. So through different equipment and laboratory settings, we can identify this. Like fingerprint analysis, we have a surface marker and analysis system using something called flow cytometry, but we won't bore you with equipment names. So it's the identification of the cell type we want. Other cells have a different identification. MSE are positive for these surface markers and negative for these, but different cells have a different fingerprint, so they'll have different markers positive and different markers negative. And we validate this in our laboratories with flow cytometry, as I mentioned. Here's a little, well, not a sketch, it's an actual exported graph of surface markers. And you can see very high purity. Negatives are below 1%, positives above 99%. So it's a single cell population. Okay.
So in-house, we also validate their differentiation potential, so the potential of these cells to make other types of cells.
Okay, so we challenge the MSC to 4 different tissue types. As a global standard, they utilize 3 tissue types, which is adipose tissue, cartilage, and bone, i.e. adipogenic, chondrogenic, and osteogenic. But MSC can form neurons, they can form cardiomyocytes from the heart, etc. But as a standard validation tool, we perform 3 aspects of differentiation. Okay, so that was about the cells itself. Now I'll talk a little bit about the treatments that we offer. So mesenchymal stem cell treatments. Okay, in our clinic, every day of the week we're treating orthopedic and chronic pain, whether it's degenerative discs, whether it's cartilage wear and tear, musculoskeletal degenerations, whatever it may be. Autoimmune diseases are very prominent with us as well, such as lupus, SLE, rheumatoid arthritis. Again, the mesenchymal stem cell can really modulate aggressive immune response, so it's a fantastic tool in autoimmune disorders. Diabetes and metabolic disorders. Type 2 diabetes responds very well. Type 1 is a much more complicated form of diabetes, but type 2 diabetics really respond well to our treatments. Degenerative eye conditions, macular degeneration, etc. We see thickening of the retina and improved visual fields after treatment with stem cells with degenerative eye conditions. Neurological and developmental disorders, things like stroke, etc., Parkinson's, multiple sclerosis, even though it's an autoimmune stroke neurological disorder, responds very well. Developmental disorders, we treat a lot of autistic children, a lot of global developmental disorder children as well, with fantastic outcomes. We see stopping repetition, improved visual eye contact. With autism, non-verbal children are very hard to treat, but children with verbal aspects we greatly improve, and very successful outcomes. So this is a little summary of some of our most common conditions. But we have treated a range of other conditions not listed. Obviously, there's some obscure rare conditions without a lot of data, but these are the most common ones seen in our clinic.
Yeah, and I just would add to that as well, like We obviously tried to give you a basic introduction into how these mesenchymal stem cells work, but obviously these treatments, this is to give a very high dose of biologically young cells, so it kind of amplifies or taps into that potential, and then it's about context-specific or disease-specific application.
So of course the core foundation of our treatment is the mesenchymal stem cell, but then we require supportive therapies. We need to address the body's microenvironment by giving things like intravenous curcumin or intravenous resveratrol, or oxygen therapies like ozone or intravenous oxygen. Also stimulation of certain cell and tissue types where we use microRNA. We use these to trigger activity in certain tissue regions. With disease, some cells and tissues become stagnant and almost stop producing their own proteins and peptides. When we utilize microRNAs, we can trigger activity in this tissue type, and the tissue will begin to produce its own proteins, and that will induce activity to the region and enhance with cell migration and targeting. So we have an isolated selection of these products for certain conditions. Treating a neurological condition, say we need to target the basal ganglia or something in the brain, we will utilize messenger RNA from that tissue. But if we want to target cartilage, of course we'll use cartilage. Or if we're looking at the knee as a whole, maybe synovial tissue, bone, musculature, etc. So each condition has its own unique supportive therapy program, which is personalized. Every patient's different in severity or complications of their disease, so we must personalize the approach. But the core foundation is the mesenchymal stem cells. You can see in some of the images here, this is intravenous blood irradiation. Actually, green laser, when the biophotons hit the epithelial cells of the blood vessel walls, they produce more nitric oxide. This nitric oxide reduces blood viscosity, allows microcapillary dilation. So the body's circulatory system is opened up and blood stickiness has become reduced. So say we want to target the eye, microcapillaries in the eye are open, allowing more cells to enter the region. If you introduce certain lasers to tissue, they have different effects. Red wavelength laser increases ATP production and mitochondrial activation, also can increase human growth hormone expression by up to 600%. So certain therapies can really target different approaches of treatment and can enhance the cell's outcome. Okay. So, anti-aging treatments. We're all aware of the signs of aging, visual aging, changes in appearance, skin, hair, weight gain, etc. Hopefully not so many of them with myself yet, but that's okay. Decline in mobility and increased pain. Sure, as we're aging, we get more stiff, we find it harder to get out of bed, we have aches and pains. This could be through increasing chronic inflammation, reduced muscle strength, reduced bone health, etc. Reduced organ function. Sure, diabetics have reduced function in the pancreas. People who smoked or have lived in polluted cities get less function of the lungs. Cognitive function and brain function declines prematurely with stress and toxins and lifestyles. So these are general signs of aging. Vision and hearing, etc. as well. So skin, of course, is the one that everybody sees. As we age, with the decline in cells, we have a decline in skin cells. Less stem cells, less active fibroblasts, less collagen synthesis, less elastin production. We have a progressive visual sign of aging that continues in later life. This is a lot to do with stem cells, if not completely to do with stem cells. So anti-aging stem cell treatments, in our clinical experience across the board in a generalized set, vitality and rejuvenation. I myself, when I do stem cells, I feel very vibrant, very focused. It's almost like I'm seeing in slow motion. My brain is interpreting more photos per second. Everything seems more streamlined and in place. Of course, I don't have aches and pains progressing yet, but if I did, and the elderly patients we treat, they always comment on less pain, improved mobility, etc. Capacity for physical activity. We treated a number of pro athletes, some World Cup winning cricket players from last year, some tennis pros, some UFC fighters, one championship fighters, pro golfers, etc. A lot of them comment not only on the pain and injury that we address, but one very famous cricketer came back to playing test match cricket after retirement, probably one of the most colourful characters of cricket, and he puts it down to our treatment. So seeing not only injury treatment, but an enhancement of the athlete. Organ and gland functions. Sure, across the board we're seeing improved blood chemistry, improved organ function, whether it's liver enzyme reduction, whether it's creatine reduction and improved kidney function, whatever it may be. General across the board you see an improvement in body's functions. Stamina and libido. Sure, stamina's improved, and a lot of people comment on libido improvement. Not only is mentally, but physically improved. There's a stronger desire and a stronger performance, if that makes sense. Stronger, probably not the right word, but better performance. Okay, enhanced immune function. Of course, if we have introduced young stem cells that have repopulated and stimulated your own stem cell pools to flourish, then your immune system is one of those cell pools that is flourishing. Of course, the bone marrow produces progenitor cells, hematopoietic stem cells that produce different immune cells. This is enhanced production, and we can gauge this by looking at things like natural killer cell cytotoxicity profiles, which would be addressing your immune cells' function. Across the board, we see improvements in this. And general improved quality of life. So here's some pictures of different patients having different treatments within our clinic. Some intravenous infusions, local injections. So one thing to point out, in our clinic, we generally follow an intravenous infusion and local injection set. We want a systemic rejuvenation of the body via intravenous infusions and a change to the local tissue environment where the problem is. So if someone wants to rejuvenate the face, of course we inject to the face. If someone has premature hair thinning, we can inject to scalp. If someone has some localized problem, knee, back, muscular, whatever it may be, we will target the area, but also flood the body intravenously. The reason is we want to control systemic inflammation, repopulate in a systemic manner, and address the local niche where the injury or problem sits. Okay, and sure, here's some whole body laser irradiation and some local injections as mentioned. Osteoarthritis. So time ago, this is probably our most common treatment, osteoarthritis and degenerative back conditions. So we see cartilage remodeling, cartilage formation, thickening of the cartilage, increased articular gap space, reduced chronic pain, improved mobility, and we can see this in MRI reports. It takes time to remodel the cartilage, it's not overnight. We would generally advise a patient to look at month 3, no sooner than month 3, to compare an MRI. The pain and symptomatic improvements occur before that, but the actual tissue remodeling takes time. It's taken you years to degrade the tissue from excessive workouts or whatever it may be that's degraded the tissue. It will take time to repair the tissue. In our lab, to change a stem cell to a chondrocyte takes us between 11 and 13 days. Just to change it into a cell, let alone a complex structure, it does take time to remodel. So we see reduced inflammation. We see things like tumor necrosis factor, interleukin-6, etc. These inflammatory markers reduce. The problem is, if you have chronically inflamed tissue, you cannot repair. Tumor necrosis factor is an inhibitor of stem cell regeneration. So the MSC's immune modulation aspect and dampening of these inflammatory markers is greatly needed to allow repair to take place. So we enhance this with things like intravenous curcumin. You've all heard of oral curcumin, it's a great anti-inflammatory. We utilize it as an intravenous method to dampen inflammation systemically to allow quicker repair to take place. We don't necessarily want all the action of the stem cells just to be immune modulation. If we can damper some to begin with, it's very beneficial to the outcome. So, okay, we see improved joint strength and reduced medication requirements. So as I mentioned, this is a generalized set of improvements. Obviously, there's many more aspects to explain and look at, but this is a general. You can see here some pictures. This is a shockwave on the knee. We do this to cause microtraumas in the tissue. We want a repair signal increase in the area. So we mentioned before, stem cells can respond to repair signals in trauma. Sometimes we will cause microtraumas in a tissue to enhance that localized repair mechanism, to allow more targeting of the tissue via the stem cells we inject into the body. Okay, here's a local knee injection. Here is some laser irradiation of the knee after injection. And this is actually my knee with laser fiber optic into the articular capsule. So, as I mentioned before, different wavelengths of laser do different mechanisms. As a rule, after we inject stem cells into tissue, we will follow by a selective laser wavelength to trigger whatever activity we're looking at. Blue is very suppressive to inflammation. Red increases energy in mitochondria. Green increases nitric oxide and oxygenation, etc. It's a little like nature. I mean, the role of green leaves, the role of red sun, fire, the role of water and blue, it's very similar in your body's response to biophotons. Blue is, of course, calming and dampening, red is energizing, green is oxygenating. It's incredible how it's very similar to the occurrence of your body. Okay, then we have degenerative spine. So when we treat degenerative spine, we actually inject to the paraspinal muscles around the region of interest. Okay, and again, we see tissue remodeling and restructuring. Many times, like we see a dehydrated disc on an MRI after local injections, you see the contrast change on a following MRI, and you see rehydration of the disc. You see some restructuring of degenerative bone in the spine, a lot of muscular strengthening for things like prolapse or bulging discs, etc. Injecting into those musculature not only reduce the pain, but can strengthen the muscles as well. We don't inject into the vertebra itself in our clinical practice. Some severe cases, we may do this under fluoroscope in one of our hospital partners, but as a general rule of thumb, it's paraspinal muscle injections. Okay, so reduced pain, flexibility, mobility, muscle strength, and reduced medication requirements, like I just mentioned. So here you can see some pictures. Again, this is some physiotherapy prior to some neck injections, local injection to the paraspinal muscles, some laser needle irradiation after the injections. This is probably to the facet joint region for neck arthritis. And here is some biophoton therapy to the spine. Okay, diabetes type 2. Time and time again, we see a decrease in HbA1c, fasting blood sugars, C-peptide, as well as inflammatory markers like mentioned before. Also organ improvements and reduced complications. With diabetes, we see eye degeneration, kidney degeneration. Your vascular system becomes brittle and rigid through sugar deposits, which can cause retinal detachment and hardening of the microcapillaries, reduced arterial blood flow to the kidneys that leads to atrophy, etc. Reduced blood flow to the lower limbs that leads to peripheral artery disease or neuropathies. So these are made complications of diabetes, and they're the complications that end up causing the biggest problems. So, of course, we want to address the diabetes, but of course we want to address the established complications with that patient, whether it's diabetic ulcerations or whatever it may be. So, time and time again, we see decreased blood test results, many patients. This is with type 2. Type 1 is more problematic. It's an autoimmune condition attacking the insulin-producing cells. Type 2 is more lifestyle and adult development, much easier to treat. We can gauge the outcome with type 2. Type 1 is more problematic and a little hit and miss, but type 2 is very easy to gauge the outcome for. So yeah, we see reduced fatigue, reduced complications, vision improvements, reduced numbness, etc. Here's some pictures of some diabetic patients having infusions. Of course, with diabetes, we're tackling the pancreas, so it's mainly IV. But if there's reachable areas for complications like the eye, lower limbs, ulcerations, we will tackle those as well. But generally, it's an intravenous infusion. So for diabetes, we would use also pancreas, microRNA, adrenal cortex, and some other stimulation to increase metabolism and address the pancreas. Okay, so here's some statistics to look at as an overview. As I mentioned before, we also supply cells to other institutes around Southeast Asia and Thailand, and this is some collective results. Osteoarthritis. Everyone's a responder in osteoarthritis, mainly significant response with good cartilage remodeling, medication requirements, etc., depleting. Some partial responders, probably the patients who are clinically obese or do not follow correct instructions post-procedures are the partial responders. Of course, patients need to follow our advice and really look at the condition that we're addressing and change the lifestyle as well. So, rheumatoid arthritis, again, good response rates, a lot of significant response. Partial responders are probably patients who've already got deformities and bone abnormalities that have developed from it, and that's a little hard to cure pain levels. So we maybe class them as not significant, but people without bone deformities, etc., all significant response. As I mentioned before, diabetes type 1 is very hard to treat, much harder than type 2. We do get some non-responders in type 1 diabetes where they have no clinical change, and there's an element of cryptic reasons why, and it's something that the entire world is working to try and unwrap and understand more. But we do see some improvements for sure, mainly in the juvenile forms. Okay, type 2 diabetes, much better response. We've already been through some of the outcomes. Chronic back pain, in our clinical setting, I mean, everyone improves. The pain depletes, and mobility improves time and time again. It's a very common outcome. Chronic fatigue, we're seeing everybody get some rejuvenation in regards to chronic fatigue. Whatever it may be, an old residual virus that the immune system's continuously chipping away at that causes fatigue, lifestyle problems, whatever it may be, organ deficiencies. We do see across the board complete rejuvenation for some degree of time in chronic fatigue. Heart disease patients, a lot of patients, we've had patients with ejection fractions as low as 16 coming to our clinic, coming back 4 to 6 months later, sustained at 28 or 30. Dr. Tut, my medical director, actually was pioneering a company where they performed local injections to the heart by opening the chest and injecting stem cells into the heart tissue for cardiomyopathy. And he treated over 600 patients. So this was 17 years ago. It was very pioneering with incredible outcomes. But now the world has evolved and we don't need to have this aggressive placement. We don't need to open the rib cage and inject into the beating heart. We can somewhat target with intravenous infusions and directed stimulation. Okay. Liver disease, very amazing outcomes. We've treated people with compensated liver cirrhosis where we've had to tap fluid from their abdomen up to 5 liters every third day because of ascites. Their blood composition really failing with hemoglobin as low as 6.4 or 7. Almost non-existent albumin production. Their liver enzymes were almost non-existent, not because there's no problem with the liver, but because their liver cirrhosis was so bad. Fibrosis scores maybe 12 or 11 in the category. After stem cell treatment, we see normalization after about 2 months, no ascites. We're seeing them have proper ability to urinate and release water and not have it pool in the abdomen region. improved blood chemistry, improved albumin production, just incredible results in the liver. The liver itself is very regenerative, but when you add young stem cells to it, it really has a very powerful treatment. Kidney disease is a little tricky. If the kidney has shrunk, a lot of atrophy, and the blood flow is really, really low, it's very hard to bring that organ back when it has shrunk so much. It's a very dense tissue that doesn't really regenerate so well itself. So kidney disease, if we can get it early enough, great outcomes. But once that kidney has really shrunk a lot, it's very, very hard to bring it back. So if patients have already been on long-term dialysis, there's not really much response, to be honest. Lung disease, very easy route. Of course, intravenous blood goes to the lungs first, so the cells go to the lungs. Asthma, chronic bronchitis, emphysema, COPD, even some patients with IPF, which is a very, there's no treatment for IPF. It's a very awful condition. But across the board, lung conditions are showing remarkable outcomes. This inflamed tissue as a result of pollutants or lifestyle, or most recently the coronavirus with this cytokine cascade that occurs in the body as an immune response that almost causes inflammation in the lungs to such a degree you cannot breathe. Across the world, they're utilizing mesenchymal stem cells for this. An infusion of MSC can suppress this aggressive immune response and allow the airways to open up, reduce tissue inflammation. And this is the same with most lung diseases. Most lung diseases are inflammation-based. Degenerative eye conditions, optic nerve atrophies and macular degeneration. You see here macular degeneration, 5% non-responder. There's a difference between wet and dry macular degeneration. Now's not the time to explain that, but there are some types of eye diseases that do not respond. Okay, some neurological conditions, multiple sclerosis, a lot of patients. We see complete lesion removals in MRI scans for a lot of our patients. They come with lesions in the brain and the spinal column, paralyzed, chronic pain. After treatment, we're seeing removal of lesions in the brain through this immune modulation response. It's stopping the aggressive immunity in the brain. To target the brain, by the way, we do different injections. We'll enter the cells into the cerebral fluid that circulates the spinal column and brain, but also place cells into the exposed brain portion at the top of the nasal cavity. It's called an intranasal placement that allows the cells to enter the brain. A lot of infant ambulatory systems utilize medication placement in this for a direct absorption into the bloodstream. So there's a lot of companies around the world doing intranasal placement of cells as well for brain conditions. Okay, developmental disorders, autism and cerebral palsy. I mentioned autism before. Cerebral palsy, we're seeing reduced spasticity, some improved quality of life. It depends on the severity of the condition. And then general anti-aging, facial rejuvenation. I mean, everybody has improvements when we inject stem cells in the face. It rejuvenates the skin, is quite incredible, it's fantastic. So that one is 100%. Okay, so that was a little summary from me about our stem cell treatments and the stem cells we use. Now I'll pass it to Dr. Nick to introduce his specialty, which is Ipsc.
Sure. So as Paul just summarized, everything that we had talked about was this kind of special class of stem cells which have this powerful therapeutic potential. But if we go back to, I think next slide you can go to, so if we go back to the kind of, if we go back to the hierarchy that we talked about, everything that we just said was a kind of special class with these therapeutic signaling properties. But in this hierarchy, you can imagine in the video, and as we at the very beginning when we were an embryo, we had these highly proliferative, these stem cells that can expand limitlessly, which can make every tissue, every cell type in the body. So as you mentioned, that's kind of been the kind of a very, very strong research goal to be able to obtain these cells. The problem historically was that embryonic stem cells, which probably most of you have heard of, has very like bad ethical problems because you can only get them from an embryo, and they are then not matched to you, so it has to be another embryo. But of course, if we could obtain pluripotent stem cells, then we could use those to make any cell in the body. Let's have the next slide. Thank you. So again, as we mentioned, the different multipotent stem cells that you have in your different tissues, they are, through your life, undergoing aging. They are losing their potential to replenish tissues over time. Thank you. Okay, I'll try this one. Okay, that should be better. So, yeah, so as we mentioned, the multipotent stem cells that we rely on every day to be producing new cells to keep our tissues functioning, they are aging, they are dying, we are losing them, they are losing their capacity. Let's have the next slide, thank you. Whereas pluripotent stem cells, they have unlimited self-renewal potential. So in the embryo, as the embryo is growing, they actually have a lot of extra systems switched on which protect them against these replication problems. Okay, they extend their own telomeres, which is depicted on the right. They actually have other systems that protect their internal cell machines, and that means that they can continuously produce new cells. So obviously that all sounds great, but how can we get these? How can we use these as a therapeutic source? So basically, I had the honor of working with the scientist who discovered this technology, Shinya Yamanaka, who works for Kyoto University, and he won the Nobel Prize for this discovery. But basically, his discovery was that actually you could take any cell, any adult cell, and reprogram it into a pluripotent stem cell that then had these embryonic stem cell properties that they could produce any tissue in the body. And this works basically by introducing a few genes which activate the programs which make the cell pluripotent. And during this, you can go next slide, thank you. So during this reprogramming process, firstly, the potential of making a pluripotent stem cell obviously is very exciting just to be able to produce any type of cell. However, I think possibly the most exciting and fascinating thing about doing this is that when you generate pluripotent stem cells, it totally reverses the biological clock. It erases all genetic changes that happen over time. It completely clears the slate, and the cells are basically identical to an embryonic stem cell, to this fetal cell source. And so, basically using this technology, this knowledge, we're able to reprogram one of your cells, a patient's cells, into a pluripotent stem cell with this potential, and then bank it in a cryobank where it can be used as a resource to produce new cells matched to a patient's genetics at any time. So as I mentioned, these cells originally from the embryo, or like these embryonic stem cells, they can produce every tissue, so it means that they can be directed through signaling and through their environment to produce any type of cell, or even organ sections or entire organs, which is kind of the frontier of research at the moment. And then using these cells, there are various applications, and each of them are at different levels of development in the world. The kind of ultimate one, which is the most exciting to me, and I think will be the future of regenerative medicine, is to use them as a source of cells to match your body. So for example, we could take your matched pluripotent stem cell, ultimately make a liver progenitor cell, and then inject those into your liver, flood your liver with brand new cells at a scale that just couldn't be done with any other technology. We could repopulate someone's immune system, ultimately introduce new microglia into the brain to improve brain health. There are projects in almost every tissue you can imagine being developed at the moment. So let me go back for a second. So then also, so as a resource for cell therapy, maybe is like the most exciting and the one which we can all imagine, young cells being implanted into your body. However, there's also lots of other quite interesting applications. So for example, firstly, you could use them as a factory to produce proteins. So for example, we talked a lot about these mesenchymal stem cells, this kind of special class of stem cells. So for example, we could take iPS, make it into a mesenchymal stem cell, and continually produce those therapeutic molecules. And that could be applied into other tissues to produce, proteins which are crucial to brain function or something like this. That's a very interesting kind of short-term opportunity. Then obviously looking further into the future, there's things like organ transplants. So a lot of teams are now at the level of producing organ tissue in the scale of millimeters or centimeters, which could be engrafted into your own body at some time. They can be used for disease modeling. So actually this was the first major area that this technology impacted human health, which was, if we can make any cell in the body, then we can study any cell, okay? And we can study it with your genetics or with a patient's genetics, and that rapidly accelerated drug discovery, repurposing drugs to different applications. It rapidly accelerated understanding disease mechanisms. I mean, many new targeted therapies which you read about were discovered using this technology. And finally, one which I also love and look forward to its realization is gene correction. So for example, imagine that you have a somatic mutation, a germline mutation. So let's imagine you have a mutation which is going to give you some degenerative disease or some problem in some organ. What we could do is we could generate your stem cells, and then in these cells that have huge expansion potential, they can produce this limitless supply of cells. If we correct the genetic mutation in that cell, which can be done very safely outside the body. Inside the body is much more complicated. But if it can be done in that cell, then that could be banked and used as a resource to produce gene-corrected cells. So for example, for many patients, this could be transformative. If you have blood disorders or some degenerative condition, we could produce the healthy cell and then implant that into the body.
Yes. Yes, they obviously with type people, a lot of the time they have thalassemia. It's very, very common here. If we could gene correct their IPS, we could produce their fetal hemoglobin and the cells that produce this without the genetic error, allowing them potentially to be free of the condition. So it's an amazing tool, having this gene correction.
Yeah. So, and then, for example, right now, our major focus is two main areas. So one is we are using IPS to generate progenitor cells and stem cells, and we have various programs at different levels of realization. You can imagine the obvious goal there is if we can produce the multipotent stem cells which you rely on every day and give you those, that could have a major impact on your own ability to regenerate. Obviously, we are also focusing on making MSCs, mesenchymal stem cells, as that's the major focus of our therapeutic applications. And then we have various immune cell programs developing blood stem cells and immune cells as well.
I mean, just to quick summarize, Stem Cells 21 uses umbilical cord stem cells that are multipotent cells that have a limited lifetime. iPSC is reprogramming your cells to be an immortal cell line that are capable of unlimited replication that could be used to grow cellular therapies for the rest of your life from 1 4mm skin biopsy. There would be no need to ever harvest your tissue again. This is an immortal cell line that can be used to make any cellular therapy in the future. And potential entire organs for transplant. With more innovation as the years come, iPS cells will be at the forefront of regenerative medicine. Clinically, we don't use the iPSC to inject the patient. We use them as a factory source to proliferate huge volumes of cells, which we then change into specialized cells, whether it's your own mesenchymal stem cells or your own natural killer cells. They function like day one. I mean, that is the beauty of iPSC.
Yeah, so anything that you produce will be biologically young, which is obviously amazing.
Okay.
So I'm going to take you through the stages of iPS generation. Thank you, yeah. So, the key points which we just made are that, this is the idea of trying to create your own embryonic stem cell which can be used for regenerative medicine or different applications. Now I'm going to take you through the process, but don't worry if it loses you, because the key information is what we just said. But basically, we take a skin biopsy, and from the skin biopsy, we isolate skin fibroblasts, so dermal fibroblasts, which are one of the best cells to reprogram for many different reasons. And then we introduce into these cells, these 4 genes, the Yamanaka factors, which this Japanese scientist discovered. And then firstly, this is the establishment of a fibroblast patient line. Not too easy to see on here, I apologize, but basically from the skin biopsy we're able to isolate a kind of stable line of fibroblasts. They actually look quite beautiful if you can see them better. And then with these fibroblasts, we introduce into them, we create temporary holes in their membranes, and then into them we introduce a transient molecule which exists only for less than a day, which activates the beginning of this reprogramming process. And that happens quite quickly, so actually I will monitor these on a daily basis when it's happening, and you can see them physiologically change, morphologically change during, thank you so much. So you can see, so basically they start to compact together, unfortunately not too clear here, into colonies. So fibroblasts are long spindle-like cells, and then when they become IPS, they become much smaller and they start to proliferate at a very high rate. So they, over time, form discrete colonies of rapidly proliferating cells. So then from there, we isolate these IPS fractions. And at this stage, we can kind of be confident that we already have your generated embryonic pluripotent stem cells. But obviously from there we enter a kind of long characterization and safety screening process to understand really are they exactly what we want. But you can see it phenotypically very quickly that they grow as these kind of beautiful round large colonies. And then over the first weeks we stabilize them into a kind of stable line before we start this characterization process. And then just a few images of this. And ultimately this is the goal, is we will freeze 1 million of these IPS in these vials, which can then later be used to take out and generate a limitless source of your own genetically matched cells.
Okay, and that concludes our presentation. I hope you found it interesting and could understand the flow of the conversation. We tried to make it understandable. Please, if you have any questions, you can direct them to us. I hope you enjoyed, and thank you very much.
Thank you. Go ahead. You want? Sorry.
Yeah, that's okay.
We're staying here or not?
You guys can sit. Okay, thank you, Dr. Nick and Paul. Let's give them another round of applause. That was very interesting.
Yeah. You staying here?
Just a few short weeks ago, we had the opportunity to have a couple test subjects here that we brought in to try out some of the treatments. This is a beautiful marriage between what we do here at Thanyapura and what Stem Cell 21 does. Because at Thanyapura, we focus on lifestyle medicine. So as Paul said during his presentation, he mentioned that it's really important to take care of to have a healthy lifestyle, to take care of yourself. So this is what we do here at Thanyapura, and having these stem cell treatments together with that comes up with some pretty profound effects. So we have had some early test case subjects, and I'd like to call Sam up here. Samantha is one of our cases, and I'd like to hand over the microphone to her so she can tell you a little bit more about her experience and her story.
Hi. This has been long, so I'm going to try to make my story really short for you. 9 years ago, I bulged a disc after having 2 babies very close together. I heard it 2 or 3 more times as I was going through my 30s. And then I got to my 40s and I heard it again, but it took a lot longer to heal. And in July, I herniated it, so my L4-5. Disaster. Sort of thing where you're in bed at night crying at the thought of turning over because that motion just hurts so much. Anybody in here with back pain? Okay, so you know what I'm talking about. It's debilitating. And then you get to the grocery store and realize you can't actually lift your groceries from the cart into your trunk because that's not good for your back. So that's the kind of place that I was living. I had done some excellent physiotherapy, but there was a big gap between doing physiotherapy and having surgery, which seemed to be the next possible thing in the hierarchy. It was like, Go and have traction, and then when you're in agonizing pain, come back and we'll operate. And I believe there had to be something in between. And I happened to be in the right place at the right time with my very sore back, holding myself up against one of these poles in Divine while I was having a conversation. And Philip said, what's going on here? I was like, oh, my back. And he said, Nikki, put her on the list. And then he went and gave a speech. And I was like, what list am I on? What's he talking about? Nikki's like, I'll explain it to you later. And she's like, it's stem cells. I was like, okay. And I walked out and I was like, what is she talking about? But I had two people I trusted very much tell me that there was a really good chance that this could help. So I said yes, and then I researched it, and then I panicked because there's a lot of needles involved, and I'm not good with needles at all. And I warned the team when they came that I was the person who was going to like jump off the table in the middle of the whole thing. So they were very kind. They made me very comfortable. It was far less painful than it was in my head, which I was very much relieved by. It was done 7 days ago. Their head nurse, amazing. The IVs that you see, it looks like that laser goes in your skin twice. That was one of the things that I was obsessed about when I was looking at it online. It doesn't. It's only in there once. The other one is just kind of taped to your forearm. Every IV was done beautifully. They were super kind and very gentle with me. And that was 7 days ago. No, 10 days ago? 10 days ago. 3 days of resting and healing. And then you can sort of resume some normal activities. I'm not about to go run a marathon, but I am not in any pain at all. I can feel like pressure where I know the disc is still herniated, but there's no pain. So I'm excited to see 3 months from now if there's repair and cartilage and all of this good stuff happening. But I'm also just really excited to not be in pain. So that was worth all of the needles and all of the kind care, in my opinion, to just be able to sit there for this presentation and not be in agony, and be able to walk up and down the stairs and carry my backpack, which I promise is still not too heavy, and know that I'm going to be on the road to running again one day, hopefully. That's my story.
Fantastic.
Thank you. You're next. Is Anthony next?
Thank you. You're a hard act to follow. Hi, I know a lot of you, and I'm sorry. Good. My name's Anthony, and I've lived in Phuket for 33 years, having arrived here before most of you came, and at a time when there were no real medical facilities here except the old mission hospital. So to be sitting here and listening to this on Phuket Island is quite extraordinary. When Thanyapura first opened, it was an innovative approach to wellness and the service involved in the wellness business, and this is just on another level. I mean, I kind of understood what you were talking about, and I didn't care to, and I wasn't worried at all about being a guinea pig. Like Samantha, I was sort of limping in on my bad ankle for many, many years here as a member of the health club. And Philip said the same thing. He said, I've got something for you. And I thought he was giving me a birthday present. He didn't know it was my birthday. And I had this really significant birthday last month. He said, I have a gift for you. And I said, oh my God, you knew it was my birthday? And he said, no. What? Oh, happy birthday. And I put you on the list. So, like Samantha and the others involved, 10 days ago, I came and had the curcumin infusions and the resveratrol. That's it. Grapeseed extract. It's like apparently drinking 1,000 bottles of red wine without the hangover. So I I really didn't have any dorsiflex rotation, a great limitation in after spraining my ankle very badly twice, 9 years ago and then 5 years ago, really badly, didn't rehabilitate it properly and was lazy and therefore lost with age the ability to have that range of motion and movement in my ankle. And I was thrilled at the thought of being able to be involved in this because I just couldn't exercise it out. There was something in there that just, you know, it was a bit numb and tingly and all sorts of other things, cramping. Met these guys. Dr. Tut is my new hero up the back there, and he and the inimitable Dr. Joyce. And I came here like Samantha had a great service experience as well. It was a very caring and thoughtful process where they anticipated my anxieties and almost answered questions in anticipation of me asking them. They knew what they were doing. I felt really comfortable by the whole thing, and I didn't feel like I was a guinea pig. I felt this was a very well-oiled machine. So 10 days later, I'm not yet hopping on my left ankle, but I've seen significant small improvements, and I guess as Dr. Nick came in and told me during the procedure, it's going to take, you know, a couple of months for this to be regenerated, and I guess joint and ankle stuff is quite a high success rate, which is fantastic. So I'll be skipping and dancing with you all in 3 months, right? So thank you again to everyone and to Thanyapura for bringing you guys to Phuket. I think running this hotel association here, I can only tell you that anything that we do here that adds experiences that are not about the beach and bars and jet skis and girls and all of that, and when we can reposition Phuket's the perception of Phuket as a destination to be more in line with wellness and sport and yachting and other things that don't require mass tourism, it's a really good thing for the future of the island. So well done, and thank you very much.